the phrase drinking from a fire hydrant because it was used so often. But they have passed most of those trials and tribulations. Someone mentioned earlier there's only one more examination this semester. They await a large exam in June. But we're gathered here today at this important ceremony to mark the change between the classroom and the clinic and the hospital as educational settings. So, to you, the class of 2019, we challenge you. You're the physicians of tomorrow, and tomorrow is 2 years away. We challenge you to become competent and humane and caring physicians. We're all proud of you, the faculty, the staff, and everybody in this hall, and most of all, anyone over 60 hopes that you'll do very well. It's now my pleasure to introduce Dr. Jane Egerstad, here in her role as Vice Dean of the Medical School and also Vice Chancellor for Academic Affairs for the Health Sciences Center. Dr. Egerstad.
I also want to add my congratulations to you all and welcome you as colleagues. You might feel this is a little premature, but you know, right now, even now, you're coming in as colleagues in this most noble profession of medicine. In thinking about the importance of humanism in the practice of medicine, I invariably think back to the time when I was still performing cardiac surgery. And I think of two cases. One was an adult patient and one a child. And those really even now, stick out in my memory. One ended up ultimately doing very well. The other unfortunately passed away. Both were high-risk cases, and both were very sick and unstable before and after surgery. I remember using every bit of technology. I think to what Dr. Platt just said about how everybody now is so technologically savvy. I used every drug I thought would work to keep their condition going well. I called consultants to see if they had any ideas that I hadn't thought of. And at the end of the day, each was still critically ill. And I had nothing left in my bag of tricks. Their families, who of course didn't understand how grim things were clinging to hope. And I felt horrible, because I knew what was likely to happen. I remember feeling pretty defeated, like I hadn't served them well, but that I had to do something. And I remember thinking this thought clearly. This thought came into my head. If there's nothing else I can give these patients, or let's say this patient, one at a time, what I have to give them is me. So that's what I did. Big smart heart surgeon. Somebody who took a lot of tests, passed a lot of tests, did this hard residency, all this kind of stuff. Understanding all the technology and all the medications, and reduced, if you will, to sitting at the bedside, holding the patient's hand. I ended up giving them the simplest and most basic thing, me, because that's what I had left to give them. So let's talk about the wonders and the dangers of technology. Like all U.S. medical students in the 21st century, you began your medical school career, even before your medical school career, with a big dose of technology. During orientation week for you in your freshman year, you were learning how to use your laptop if you didn't know how to do that already, getting acquainted with Moodle, taking web-based exams, regularly communicating with faculty via email, tweeting, twittering, everything. As you move into your clinical years, you'll become proficient with electronic medical records, learn how to look up diagnostic studies on web-based systems, even communicate with patients via texting. This is really wonderful stuff. And given the explosion of knowledge of medical science, as it has in the past 30 years, it is absolutely essential that you use these tools to keep yourself up on all the most current treatment. But these things are tools, and tools are things to master and not be mastered by. So as you enter your clinical years, you will see that there are ways in which technology and electronic resources can easily decrease or even replace your face-to-face interactions with patients. And if you're not careful, you can begin to justify this in your head. I'm just so busy. Well, sorry. They got an email. I have so many patients to see. I just can't stop and talk to everyone. And you begin to say these things in your head and think that's the right thing to do. So I close with a caution and a request. Yes, you'll find yourself really busy as a physician, but I ask you to start now to develop a keen internal awareness for those moments when a patient truly needs to see you, needs to sense your humanity, not get information by letter, or an email, or a phone call, or even have someone else talk to them in your stead. Such moments may be difficult to identify sometimes, or they may be awkward ones, and you recognize them by the fact that your instant gut response is, I don't think I want to do that. And the problem nowadays is that it is very easy not to do that. Just send a quick email. Just make a note in the electronic medical record. That should be enough, right? You have to think twice about that. Over time, I've learned that as a physician and simply as a human being, the times I really don't feel like I want to talk to a patient face to face because the conversation will be hard or sad or scary, those are the times I really should, out of respect for their humanity and to remind myself of mine, do that. Because in spite of all your knowledge and all your skill and the extent to which you can use technology, at the end of the day, what you really should give your patients is you. Thank you.
It's now my pleasure to introduce Dr. Ghali here today in his role of Dean of the School of Medicine, also serving as Chancellor of the Health Sciences Centre here in Shreveport. Dr. Ghali.
Thank you, Dean Platt. Vice Chancellor Eggerstadt, Dr. Griffin, it's my honor to serve the podium with you guys, and I want to welcome everyone here and welcome the class of 2019. It's a beautiful day that our Lord has created. As you look outside today, you know, one of the things that I see is the flowers starting to bloom and the azaleas and just how beautiful of a day it is. So I'm going to be quick. Dr. Griffin promised me he'd be quick too, so y'all can get out and play as quick as you can. This is a great occasion, and I thank our faculty that are here, as well as other students that are here helping today. And I'm facing primarily the class, because that's who I'm talking to. So no disrespect to the audience for sure. So good afternoon and welcome. This is a great day and a great milestone for the 122 second-year medical students on stage here, as well as all of the family and friends whose support has been so vital to the students. Thank you all for being here. Vice Chancellor Eggerstadt just spoke to you guys about the history and tradition of the Physician's White Coat and how it symbolizes the passage of these medical students from a time when they're learning primarily from books to a time where they'll begin learning largely from their patients. It's just kind of what y'all been waiting for anyway. So of course, we could just hand them a white coat and send them on their way to their clinical rotations, but I think it's important that we make a ceremony out of it because it celebrates their accomplishments today. And more importantly, it formalizes the great responsibility that lies ahead in their interactions with patients. As a physician, I'm proud to wear the white coat as it symbolizes both the science as well as the humanity of my honorable profession. For those of us who wear it, and all who are receiving it today, it symbolizes our commitment to maintain our humanism despite any potential distractions that may occur in order to provide the best possible care to our patients. And believe me, having just gotten back from Washington, D.C. this week, and having met with fairly high-level officials in Mr. Trump's administration, there's a lot going on in healthcare. So it's admirable that you guys are sticking with it, and I still find it to be the most admirable profession in the entire world. Over the next 2 years of medical school, these students will have much to learn about patient care. Fortunately, there will be many fine teachers and mentors to help, like today's speaker, Dr. F. Dean Griffin. Dr. Griffin is an outstanding instructor, lecturer, and mentor. Dr. Griffin is a graduate of LSU Medical School in New Orleans and received his training in general surgery at our Louisiana State University Health Science Center in Shreveport. He didn't come to medical school here because it wasn't here when he was in medical school. Otherwise, he wouldn't come here. He's shaking his head. Following 2 years in the Navy on the USS FDR, and for any of those that were born at the time that there was an iPhone that doesn't know what FDR is, it's Franklin Delano Roosevelt. In the Atlantic Fleet, he practiced clinical surgery in Shreveport at the Highland Clinic for nearly 35 years. He started when he was 10 years old. Currently, Dr. Griffin is acting chairman of the Department of Surgery, the Albert Scolar Professor of Surgery, Director of Undergraduate Surgical Education, and Professor of Clinical Surgery at our beloved LSU Health Sciences Center. I'm proud to have him here as a speaker today, and we're very fortunate that he is here imparting some words of wisdom to our class about service and humanism. Dr. Griffin.